Have you ever wondered how long it really takes for different injuries to heal? Whether it's a strained muscle, sprained ligament, or even something more severe like a bone fracture, understanding your healing timelines can help you set realistic expectations and plan your recovery. One of the most common questions I get as a physical therapist is how long is X, Y, Z going to take to heal? And oftentimes it's not as simple as giving you one answer for every single injury. There's a lot of nuance to it, but there also are some principles that we can carry through based on the type of tissue that's affected. So the goal of today's video is to go over all these different tissues and figure out, what sorts of things you can expect if you are experiencing one of these injuries so that you have a better idea of how long the rehab process is going to take, as well as what sorts of things to expect. First, let's talk about something we've all experienced, exercise-induced muscle soreness. That's the stiffness or discomfort that you feel after a tough workout. So think maybe you're in the gym, maybe you're trying a new workout for the first time, maybe you're increasing your weight. Um, After you do that, there's going to be a period where your body needs to adapt. And during that period, your body might respond initially by through a little bit more soreness, a little bit more discomfort as your body builds up the capacity to handle these new loads. The good news is this typically resolves in around 0 to 3 days. So it could be something where maybe you're just sore for the afternoon. It could be something where maybe you're sore for, a weekend, but this is something that will improve and it's totally normal as you stress your body in new ways, or maybe stressing your body a little bit more than it can currently handle. The key here is active recovery. So thinking light stretching, walking, low intensity exercise, all that can help your muscles recover faster by improving blood flow. So just remember the soreness isn't an injury. It's just your body adapting to the stress you placed on it. And after you do that same workout or at that same load a couple more times, it's likely you're not even going to experience that exercise-induced muscle soreness again. But what if it's more than just soreness? Let's talk a little bit about muscle strains next. These occur when you overstretch or maybe even tear a muscle. And the timeline for these types of injuries really depends on the severity. So a grade 1 strain are fairly mild and they can heal in about 1 to 2 weeks. Um, if it's more severe, grade 2 strain that involves more tearing, that can take around uh, 3 to 4 months. And then a grade 3 strain or a complete tear can require 3 to 6 months to heal, especially if surgery is needed, then there's a little bit lengthier rehab. And I misspoke for grade 2, it could be 4 weeks to 3 months. But what if it's more than just soreness? Let's talk a little bit about muscle strains. These occur when you overstretch or maybe even tear a muscle, and this timeline depends entirely on the severity. So if it's a grade 1 strain, they're fairly mild and they can heal from anywhere from 0 to 2 weeks. So this is something where it can heal fairly initially, or it might be something where, you have to wait a couple weeks. The next is a grade 2 strain, which involves more tearing. These can take anywhere from 4 weeks to 3 months. And then finally, a grade 3 strain or a complete tear can require 3 to 6 months to heal, especially if surgery is needed. Then there's going to be some rehab involved as well. Really, with all these injuries, there is a good chance that you will need some rehab, whether it's just a little bit, whether it's a lot. Rehab will always help speed up the process of one of these strains recovery. But for muscle strains, controlled loading is essential. This means gradually reintroducing movements and strengthening exercise without pushing too hard too soon. Overdoing it can delay healing, so it's super, super important to listen to your body. When I see patients with muscle strains, where it's been a little bit longer that they've been dealing with it, it's oftentimes because they'll go through periods of, hey, I feel great, let's get right back into exercise. And then they push a little bit too hard, and then that sets them back. And it's just a cycle that goes back and forth between feeling good, do too much, feeling awful, and then repeating that cycle. Now let's move on to ligament sprains. So ligaments are like rubber bands that hold your joints together. When they get overstretched, we call that a sprain. Most oftentimes you'll hear about like an ankle sprain. If you think you roll your ankle, you're overstretching that ligament, leads to pain and potentially damage to that area. So here's what those timelines look like. A grade 1 sprain is mild and can heal within 0 to 3 weeks. A grade 2 sprain or a partial tear could take 3 to 6 weeks. And then a grade 3 sprain, which is a complete tear, can take anywhere from 3 weeks to a year. Again, depending on whether surgery is involved. Anytime we have an operation, that's obviously going to cause us to go a little bit longer. But regaining joint stability is the goal here. So that's why rehab for ligament sprains often includes balance exercises, controlled movements to strengthen the surrounding muscles. And oftentimes, if it is something like an ankle sprain, super important that you're putting weight um, through that area early on so that we can start to get the body used to bearing that load again. But it just depends on where the ligament sprain. It's a little bit different if, say, it's at the knee or it's at the wrist, then maybe you want to be a little bit more conservative. But that's where consulting with a professional physical therapist can be super helpful in helping you navigate that type of injury. Next, let's talk a little bit about tendon injuries. So tendons are what connect your muscles to your bones, and tendon injuries can be a bit trickier to heal because of their limited blood supply. So a tendonitis or acute inflammation of the tendon can resolve in 3 to 6 weeks with proper care. More severe tendon injuries, this is what we would call more of a tendinopathy. And this could be like a laceration or a rupture. That might take up to 6 months, especially if surgery is required. For tendon issues, eccentric strengthening or lengthening exercises. So an easy way to think about what an eccentric exercise is, if you're doing a bicep curl, curling up is what we call concentric. You're shortening the muscle, and then curling back down, if you go nice and slowly, would be eccentric as you're strengthening as you lengthen. But that can often be one of the things that makes the biggest difference for a tendon injury. And these exercises help to rebuild your strength while minimizing the strain on the tendon. Another common injury that we see is bone injuries. The good news is bones have the ability to heal back to their original strength. The bad news, it does take time, and sometimes it can take a significant amount of time. Most fractures will heal within 5 weeks to 3 months. I will typically tell my patients, you're going to start to feel better between 6 and 12 weeks. But depending on the severity and location of the break, it can take a little bit longer too. It just depends on a variety of factors. Some of those factors include age, overall health, whether the bone was immobilized properly. Those can all affect the timeline. But following your physician's advice is crucial here, especially when it comes to weight-bearing activities. Bones heal by putting weight through, by stressing them. But if you do that too soon, that's where we start to run into issues, such as a fracture is not healing properly. Too much stress on a healing bone can lead to a lot of complications. So super, super important that you're not trying to rush things outside of guidance from a professional. Um, Next, let's tackle a more complex injury, articular cartilage and ligament grafts. So an articular cartilage repair can take anywhere from 2 months to 2 years to fully heal. This tissue has very poor blood supply, which is why it's such a slow process. And then ligament grafts, such as those used in ACL constructions, follow a similar timeline, 2 months to 2 years, and these grafts need time to integrate and strengthen before you can safely return to high impact activities. So if you have any of those kinds of injuries, you absolutely need to be following a fairly strict regimen in terms of your timeline, in terms of your return to activity, just because it's so easy to re-rupture if you don't have that guidance in place. So with those types of injuries, patience is key. So focus on your rehab and just gradually increasing your activities, listening to your body, and again, following these healing timelines. So why does understanding all this matter? Healing is not linear. You'll have good days, you'll have bad days, but understanding these timelines can help you set realistic expectations and avoid frustration because there's nothing that's more frustrating than wondering, okay, when is this injury going to heal? Why is this not already healed? But if you have that expectation early on and have an idea of what to expect, you're going to feel a lot better throughout the rehab process. And that's why I make it a point to all my patients to give them expectations in terms of timelines and when they can start to expect to do, various activities and when they'll start to feel a little bit better. But trying to rush the process will often lead to re-injury or chronic issues. So trust the timelines, focus on consistent effort, and work with a professional to guide you through your recovery. Recovery is going to take time, but the body is incredibly resilient when you give it the right tools and environment to heal. If you're dealing with an injury and want more personalized recovery plan, check out the resources I've linked below or schedule a call with me. I've got some free resources I'll link, such as a guide to understanding your knee pain. I'll try and include a graphic for these timelines for you to reference. And then if you do feel like you want more one-on-one assistance, I'll drop a number that you can text me directly for questions or if you want to set up some kind of an evaluation. Don't forget to like this video, subscribe to my channel. Let me know in the comments what injury you're recovering from or what questions you have about healing timelines. Thanks so much for watching. We'll see you in the next one.